The pediatric transplant program at Yale New Haven Children's Hospital is the only one of its kind in our state. Babies and children from around the world in need of liver and stem cell transplants come for expert care before, during, and after transplantation. Joining me today from Yale New Haven Children's Hospital's pediatric transplant unit is Dr. Debbie Chernomis and Dr. Manuel Rodriguez-Davalos. Welcome both to Connecticut Style. It's nice to have you here.
Thank you.
So, Doctor, tell me right off the bat, give us an overview of Yale New Haven's the organ transplant program.
Well, Yale New Haven Children's Hospital, wanted to focus one of the units just in the transplantation program. Transplantation at Yale focuses on solid organ, which is mainly liver and kidney transplantation, and on the stem cell program with Dr. Chernomis leads. I think the most important thing for people to know is transplantation. It's all about teamwork. It's not only what the physicians and the surgeons do or the parents. We're trying the unit to work together between specialized nurses, our medical team, surgical team, a team of child life specialists who work very close with the children and families, so we can help them through this very tough process.
Dr. Chernomis, tell us a little bit about your role.
My role is very exciting. I actually am recently back at Yale New Haven Children's Hospital after having done my training here several years ago. And I was brought back by Dr. Gary Kupfer, our pediatric oncology section chief, because he had a vision to bring stem cell transplant to Connecticut. Prior to my arrival, we were referring all patients who needed bone marrow transplant, which is another way to refer to stem cell transplant. They were being referred out of state. So if children had relapsed leukemia or diseases where they needed a bone marrow transplant, they had to leave. And it's an incredibly cumbersome process, as well as financially, emotionally, etc. And to not have your family around you at that time is very difficult. So being able to do that in their home state and in their hometown has been a great service that we've been able to develop.
Now, you kind of mentioned this, but why did the hospital decide to designate just a unit for this?
Well, in addition to needing the service in the state, I think that both of what we do has a lot to do with immunocompromising the children that we treat. So the medicines that we give them to allow them to accept the liver or the new bone marrow that we give them requires them to be very immunocompromised. So they don't have an immune system and they can't fight infection. And that makes them very, very vulnerable, sort of like the boy in the bubble, if anybody remembers back that far. And so our unit is basically a big bubble for them with specialized components to the unit and specialized staff who are trained.
And Doctor, what has the feedback been with families so far?
Well, it's been fantastic. I think that when Dr. Emery, who's the director of the solid organ transplant program, the Yale New Haven Transplantation Center, envisioned this, working together with Dr. Kupfer and Dr. Chernomis, was a place where the families and the patients would feel at home. And again, work all together. So everything that we've heard since we opened the unit has been great. I think the parents have a place to stay, the kids have a place where they can feel at home for these weeks or sometimes months that they have to be with us.
Very good. Let's put all the information up on the screen there. For more information on the Yale New Haven Children's Hospital and the Pediatric Transplant Program, just go to ynhh.org. And we want to say a special thank you to the Community Foundation of Greater New Haven for supporting this. Thank you both for being here, and thank you for everything that you do.
Thank you.